Hi everyone, this is Tony and I want to give you some information about how to complete the next exercise, the case review exercise. So what you're going to do first is go to week 4 and in there you'll find two forms. One is the SP case review list, I'll go over this in a second, and also the SP case review rating form that you'll use to review the cases. And on the review list, you'll find the people that are assigned to which cases. And so in this example, Yvonne will send her completed case to Jennifer. And I think all of you at this point have sent me your revisions. This is your last chance to make some revisions before you forward it to your fellow students. So you'll just go down the list. Each of you are going to be reviewing one of the cases from one of your fellow students. Okay, does that make sense? The next thing is to take a look at the SP case rating form. And the directions are provided at the top. So what you're going to do is provide a numerical rating and comments in three areas. I'll get into those three areas in a second. And what I'm going to ask you to do is provide a true critique, help the case author to improve their case. And this is common in SP case development meetings, for example. It's an iterative process. The cases are reviewed by multiple eyes, changes are made, and so forth. So try to be as honest as possible. And for each of the three sections, provide the numerical rating anywhere from 1 to 5, 1 being poor, 5 being excellent. And then comments, what worked, what didn't work, what needs to be improved, what you would like to see in the case, etc. And return this form once you've reviewed their case to the author, and also make a short and schedule a conversation with him or her about your ratings and comments. I'll leave that up to you how long that meeting will be, but just do it over the phone or Skype or however you'd like to do it. But send me a copy of the rating form. I don't need to be involved in the conversation. That's really between you two, okay? Now, the first thing you're gonna critique are the learning goals, objectives, and challenges of the case, which are listed in the first page. As I'm saying here, keeping in mind the learner level, second year preclinical student, all of you may need to edit this slightly. The learner level, I know that I kept it general, but you want to specify to whom this case is being written. Is it to a medical student, a nurse, or a pharmacology student? So be specific about what this case is going to be used for what type of learner. Not, the level is second year preclinical, before they've actually started to see a lot of patients. But be specific about whether it's a medical school case, a nursing school case, or a pharmacology case. Okay, and critique how well does the case carry out the stated goals, objectives, and learner challenges. Are the goals as written appropriate to how one would write educational goals? And if you're unclear about it at this point, you might just do a little research about how to write goals and objectives. The goals are general, the objectives are specific, what the learner would get out of this particular exercise, and also make sure that you write something in about how the learner will be challenged by your case. So you're going to provide a rating and provide some comments about how they can improve the case. Or if you think it's wonderful, you can say that, but again, I would really urge all of you to be discerning and helpful to your fellow case authors. Overall writing clarity. How well does the case impart information that you wrote that would help the SP understand his or her chief complaint, past medical history, psychosocial information, health promotion, and health risk factors? For those of you that also wrote some simulation directions, how clear are they? Are they clearly stated? Would an SP be able to pick this up and understand how to simulate the case? How easy is it to read? Is the case itself laid out in a pleasing way? So much of case writing is about laying it out again in a way that's really clear and readable. Are there excessive typos? That wasn't a great deal of a problem in this situation for the most part. But make sure that you always run your any documents through spell check. Is it well organized on the page, or are the bullet points all over the place? That one thing that sometimes authors do or writers do is that they mix up formats. Sometimes it's one font and then another. Sometimes the bullet points aren't indented in a consistent way. They're all over the place. And if it's not neatly laid out and if the writing isn't clear, it's not going to be as useful, because you want to keep in mind that this is a learning document, primarily that a standardized patient would learn from. So provide the rating and your comments. And then finally, the case information. How complete is the case information? One thing I noticed is that people mostly stuck to the template and didn't add questions. There were some situations where you did, which is really what's called for. The template is just to get people started, but are there follow-up questions that need to be added? For example, because there's a likelihood that they would be asked. Is the history complete? And one mistake I made in sending you the template was I neglected to put the medication icon in there. But some people brought up the medication anyway that the SP was using, which is fine, but were unclear about dosage, whether they were taking it as prescribed, how often they were taking it, and so forth. And so you want to always keep in mind that the SP case is a document that in many ways predicts the most common questions that will get asked, and then you providing the appropriate responses. You don't want to have the SP making stuff up, especially around important medical information. So you're going to have to just think through what's likely going to come up during this encounter by this student. What are they going to ask, and how is the SP going to answer that? And that, therefore, then you'll provide a rating in that section and comments, suggestions. You might want to add in what information they should be asking and so forth, as I did with some of your cases. Finally, the deadline, I would say try to get this done within 2 weeks. It's, again, intended to be helpful to each other. Once you complete this part, there's no need to revise the case unless you want to, because you're going to use it in your own place, your own institution, which is great if that happens. And I don't need to see the final updated SP case. And just want to make sure that everybody knows that once you're done this part is done. And I hope this was helpful. I'm really up for any feedback that would help me make this a better exercise, and I hope this was helpful for everyone. So anyway, try to have fun with this, and thank you again, and I'll be talking to you soon.